Hi, I'm Virginia from the Patient Information Forum, also known as PIF, and I'm here today with Dr. Liz. And today we're going to ask them how they create trusted evidence-based health information, and you'll also learn about what they do and why they do it, and maybe you can do it too. So let's get started. Thank you, Dr. Liz, for being here today.
Thanks for having me, Virginia.
It's a real pleasure, and thank you for taking some time out of your day because I know you're really busy. So first question, what kind of health information do you create?
It's basically all around breast cancer. So I was a consultant breast surgeon and I was diagnosed with breast cancer myself in 2015 and then again in 2018 and 2023. And I thought I knew everything about breast cancer, but I realized I had so many questions. And as social media has exploded, patients are asking so many things that they don't want to ask their doctors. They don't know where to get the information. And I just thought I can help, because I've been on both sides of the table. So I kind of feel my job is to bridge that gap between what the doctors and nurses tell you and what you want to know to carry on living your life.
So in terms of what kind of content creation do you create? So you've
Yeah.
given us a fantastic reason why, and it's unfortunate that you've had to experience that, but I love that you've taken that experience and you're now going to share it, and it's kind of empowered you to empower other people with that
Yeah.
information. So what kind of types of information, or how do you present your content online?
So it started with a blog back in 2015 that then led to my first book, The Complete Guide to Breast Cancer. I just wanted one book that everybody could use to get all their answers, because I bought 10 or 20 books. And that was written with another professor of evidence-based medicine, Trish Greenhouse, and it took us about a year to do all the research and make sure everything was factual and correct. And I still write articles now and then explaining what breast cancer is. But I then got into Instagram, which is how I crowdfunded my second book, my memoir, Under the Knife. And by putting videos out on Instagram, which then led to YouTube, it's another way of giving people access to content. But I want to make sure it's accurate, and it can take 8 hours to research a script for a 5-minute video. But to me, I want to make sure that everything you hear from me is accurate, trusted, it's fact checked by my peers so you can trust what I'm saying. And it's breaking it down into bite-sized nuggets that people can understand and that are easy to read.
Yeah, I think that's so important, and I love that you've said, bite-sized information that's easy to read and trying to make it as accessible as possible,
Yeah.
because at the end of the day, that's how you're going to have impact. You're going to be able to reach people where they are, at their level of understanding, and then be that kind of book for them rather than
Yeah.
the 10 to 20 books that you had to buy. So
And
that's
a
really
lot of my content comes from listeners asking me questions and stories on DMs. I think, great, I can do a video on that and I can help everybody understand, and using simple terms, because there's a lot of jargon in breast cancer and surgery, as you know. And if I can make it really simple, hopefully you'll get that aha moment to think, oh, okay, now I know what to do.
Yeah, that's so true. And a lot of acronyms as well, like the BRCA gene, and people will be
Yes.
like, what is that? What does that mean? And so you can obviously be that kind of bridge for them to help them to understand. So thank you for sharing your story and the types of content that you create. So I wanted to say that, as you know, at the Patient Information Forum, our mission is to help people like you to provide accessible health information for patients and the public. So last year we created a set of standards for health information called the Individual PIF TICK, and you took
Yeah.
part in the pilot for that to try and be one of the first to earn a trusted information creator logo to put on your content. And I wanted to take a moment to say thank you for taking part, because your feedback helped shape the Individual PIF TICK and also some of the resources that we're going to create for future health information creators.
Brilliant.
So as well as being part of the pilot, you've now joined the PIF information creators, and we've
Yes.
got a certificate for you. So I'm going to share that
Oh,
certificate so that
fantastic.
everyone can see it.
Oh, I do
And
like certificates.
sorry,
I do like certificates.
yeah. And it's one of those things that it's nice to have once you've earned it, because you can then kind of show it
Yeah.
off. And it's got the PIF tick logo in the top left here, the Trusted Information Creator logo with the big green tick. And it says, this is to certify that Liz O'Riordan has met the requirements of the PIF tick quality mark for health content creation. And it's issued on the 1st of February, and it's valid for a year, and you renew it every year. And it's authorized by Dan Wills, our quality mark manager. So well done for earning that. I know it was a
Thank
lot of
you.
hard work.
It was a lot. I don't think people realised it was a lot of homework involved to make sure that everything I produce, where I put this logo on, is accessible and trustworthy. Yeah, and regularly checked.
Yeah, exactly. So we do an information assessment where we look at some of the content pieces that you've created to make sure that it's kind of lining up with the process that we approved. So as part of that, when it comes to how you create your health information, how did the individual PIF tick assessment help you with your content creation process? And what did you learn from doing the assessment? What were your kind of key takeaways, and how has it affected how you create your content from now on?
I think it's made me realise that I want to tell my audience what they want to hear, not what I want to tell them. So give them the information they want, and to make sure that it's in accessible words and language that they can easily understand. It's very easy to slip into jargon that no one knows what it is. It's also, it reminded me I am not very good at referencing everything I do. I can have, as I said, 8 hours of research, and I've got websites where I've fact checked everything, but I don't want to put that in a video because it's boring and no one's ever going to read in the content, so I don't put it. But actually, I need to make sure that all the evidence I've used is accessible so people can double check it. So I'm now doing that on YouTube and Instagram. So you can say, this is true. This is where I've got it from. So yes, you can't say I'm lying. Hold me to account. I think that's been really, really important. Another thing that's challenged me is, say on Twitter, I don't always use alt text to say what the diagrams are. And often I'm posting more about my own personal life. But again, making sure all the content is accessible. And especially in breast cancer, and I'm guilty of this, Virginia, we think it's a disease of women, but it's not. Men get breast cancer too. And when I'm talking about sex, I'm in a heterosexual relationship, but there are lots of other relationships out there. And it's just reminding me to say, I'm not the norm. There are other people outside, and make sure the language I'm using, and that's something I'm still learning because they're bad habits. So it's just learning the right words so you can make it accessible to all and everybody feels they're being represented. And that wasn't, I was kind of aware that I should be doing it, but I wasn't making sure I did it.
I really like that you know, it's really made you kind of consider how inclusive you are, and I've definitely experienced that as well through doing the assessment, and the kind of posters and the guides, giving you kind of the words and the way to do it in a
Yeah.
way that is, you know, respectful, to put it
Yeah.
nicely.
It's it's made me realize that most of the content out there is never checked by anybody. I could say tomorrow that bananas cure cancer, and people just might, oh my God, I'm going to buy bananas because Dr. Liz said it. And actually, if the video's got the PIF tick on it, you guys can check up on me in 2 or 3 years, and I have to go back and double check. And actually, it's been great for me to know, because there are 20 new breast cancer drugs in the last 5 years, which is why I'm writing the second edition of my book. And I need to go back and check my content to say, actually, that's now out of date. I need to change this. So I am always making sure that everything I do is current, which I think is really, really important.
Yeah, and I think that you run a really nice parallel there with your book. You know, you've said new information has come out, and so now you are updating and creating a new edition of your book. And I think we don't really see content online in the same way as
No,
books, in that, you know, they do need to be updated and have a new edition, and you always want the latest edition of the book. And then,
exactly.
of course, as soon as you create something and publish it and it's out there, there's new information. So that's going to need to happen
And
again.
it's
So it's a
like,
constant process.
someone can say, oh, but this trial said this, but they don't say the trial was from 2000 looking at 10 rats. You just hear
Mm.
the word trial. And I think it's important that we can say, this is the latest up to date information. This is what it included. You can go and find out for yourself, and actually teach the general public how to understand and interpret the facts that they hear.
Yeah, that's so important, because there is a bit of an infodemic at the moment where you are just constantly bombarded with lots of information and you don't know which one is
No.
true, which one to believe.
And I
And I
think,
think,
so it's numbers. You know, you
yeah,
hear that eating bacon doubles your risk of getting bowel cancer, but people think double means I have a 1 in 2 chance. Well, no, your risk may be 1 in 200. It's double to 1 in 100. It's not the same. And how you can kind of just, I can explain what the numbers mean so you know what it means for you, not just a tabloid headline.
Exactly. I was just about to say it's the newspapers and the media that
Mm.
can instill that fear in the public when really it's a very small number, and they need that kind of clear, trusted voice like yourself to actually explain that it's not what it sounds like. Here's what it
No,
actually means. And
exactly.
yeah, it's so lovely that you do that. And I want to actually touch on some of the collaborations that you do with charities, because that's a wonderful reason to create health information,
Yeah.
especially when you are supporting a common cause. So do you want to give a kind of example of some of the people that you've worked with and some of the impact that you've had with your health information?
Yeah, so I've done some work with Her Spirit, which is a two women, Mel and Holly, trying to get a million women active, which we know it can reduce the risk of breast cancer. Working with, I guess, exercise influencers in the UK and in Australia to try and get that knowledge coming home. Working with lingerie companies in the States to try and show women how to change their breasts properly. Stuff with breast cancer now. I'm recording a podcast with them about the PIF tick, I think, next week. I'm also now ambassador for Bone Cancer Research Trust and the Good Grief Trust, and just ways of using my status as, I guess, as a health influencer to try and get health information out there. So my name is recognized with, if I say this, you can trust me. And I think it's really, really important, because often you see celebrities and influencers coming on and doing this and doing that, and you trust it because they're saying it, not necessarily what they're saying. And a lot are right, but it's how you get that. Are they the best person to give you that information?
Yeah, I completely agree. I think sometimes there have been some controversial celebrities promoting maybe a medicine or a supplement, which
Yeah.
they may not be the best person to promote that, especially if they are being motivated by money or
Yeah,
other
and I
things.
think it's hard. I think a lot of people still won't know what the PIF tick means, so they'll see the logo and think, "Oh, what?" But what a lot of what we say is boring. It's not sexy. It's common sense. I'm not singing and dancing and lip syncing, but actually, you've got to hope that at some point people will just want to come and hear sensible information from people they can trust. To say, "Yeah, okay, fine." That's what I hope this will mean.
Yeah, exactly. And you earned it. And we really look forward to all of the health information that you're going to create in future. So, to support patients and the public with their health. And also to let you know that you'll be listed on the PIF TICK individual creator directory with a link to
Brilliant.
to all of your social media. And we update this list and we send it to GPs and other healthcare professionals twice a year as a resource, because they often ask us, who can I
Yeah,
signpost to? And so they'll know where to send patients, or even look it up for themselves to find
yeah,
trusted health
brilliant.
information. So thank you for your time today.
You're welcome. And I'd say for any healthcare professional listening, go and investigate and see. It's not as hard as you think, but actually knowing that you've got that badge can mean a huge difference to your social media work.
Absolutely. Thank you so much. So, for those who are listening or watching, if you'd like to learn more about the individual PIF tick and how to earn your own trusted information creator certificate, then go to our website, which I will leave a link attached to this video. Thank you for watching, and we'll see you next time. Bye.
Bye.